do. It's crazy how powerful a dollar bill is, that it can sway incentives and providers to be money motivated and not patient care, health care motivated. Hey guys, this is JC, the bald hearing guy, and I'm about to have a blood pressure issue with this video that I'm about to send you guys. Costco. I have a Costco near me in Altamonte, and I mean, I didn't have anything against them. I'm actually a Costco member. But these stories are just getting more and more frequent. I had this gentleman, I'm going to show you the audiogram. This is for providers to see. So as you see there, we don't have his bone conduction scores. This is all fitting software. There's no patient information. But providers, you know what you're looking at. Guys that don't, red is right, blue is left. Hold on, let me try to line this up. There we go. Red, right, blue, left. Right is way down. Left has a significant hearing loss too. But this patient is having a really hard time. He's not understanding. He's miserable at work, wife. I mean, this is a person that's broken down with his hearing. He tried over the counter. He tried the AirPods. And he goes in. I tried some good hearing aids. Nothing has worked. The good hearing aids were the Costco hearing aids. This man has a significant asymmetry. There's polyps in his ears. There's a significant asymmetrical component that the understanding was from 50% to 96%. Anything above 16 is a medical consultation. Anything above, if I'm not mistaken, it's 15 to 20 decibels at 2 or more frequencies of a difference in pure tones is a medical consultation. I mean, the amount of red flags in his hearing are significant. In my report, I wrote cochlear implant consultation because of his poor discrim, ear, nose, and throat evaluation for sure, and a possible bilateral hearing aid trial because his bilateral speech discrimination score was better than his unilateral score for just the left ear. So I was between bicross and that, but normally when people do better bilaterally, even though they don't really understand on that side, they will have a better quality of life in both. Anyways, all nerdy stuff. But here's this man's, the biggest thing is it's a medical consultation with an ear, nose, and throat specialist has to far supersede a conversation about a hearing aid. Far. Like this man's medical, he has a medical concern, right? Costco sold him a hearing aid. Not only did they sell him a hearing aid only for one ear, red flag number 1. 2, they sold him a hearing aid, a custom sealed, completely in the canal hearing aid. As you guys saw, his low frequencies were normal, significant high frequency hearing loss. They focused on their sales targets. You know, they can say they're not commissioned or whatever it is. There is absolutely a quota and a criteria here, guys. Like there is no way that is justifiable. There's no way that the person is not ignorant, that they did not think about his healthcare needs. They had to have been thinking about their performance because it is unlawful, unethical for them to have fit him with a hearing aid. This man has never seen an ear, nose, and throat, despite what you guys just saw. And he's miserable, right? Like this is a person that's upset. Like I'm enraged right now because I told him, I was like, no, I'm not even selling you a hearing aid today. You're going to the ear, nose, and throat. You're going to get a cochlear implant evaluation. We can talk about a hearing aid in the left, but your medical needs come first, right? I don't know how things like this slide. I don't know how this gets by. Thankfully, he returned. He didn't lose his money, but I mean, unless you just went from like cutting ham in the deli section and then they put you in the hearing aid department, how this flies is beyond me. And it's really a shame because this is what he thought was a good hearing aid, right? This is what people think is like this. I did my due diligence and I got a good thing. No, guys, I don't know. And I'm sorry, because I'm sure there's good providers in some of these warehouse stores. I have people on LinkedIn that work at Costco or Sam's or, you know, that they're probably good people, have a good salary. They probably do the right thing for their patients that come in. But man, the stories in Altamonte Springs, I'm going to tell you, it enrages me. I'm honestly, like, I have no other words. Like it makes me think, like, why would you consider buying your medical devices, something that is prescribed to you, something that requires a thorough evaluation, an hour and a half, not a quick screening run in the booth, something that requires all the things that we do to make sure that our patients hear their best, from the same place that you buy your mayonnaise, from the same place. And I know that that's like, tongue in cheek, and like this sort of like we hear this sort of rhetoric of like providers like, you buy your toilet paper here and your hearing aids, But listen, I'm actually going to wear that hat. I'm going to be on this team right now. No, guys, if you love me, if you're in my circle, I don't care if it's with me. I swear, I don't care if it's with me. If you're in New York, you're in another country, in another state. If you're in my same city, go see my competitor. Go see Citrus Hearing Clinic. Go see Teresa Baker. Go see Dr. Baker. I'm forgetting the name of her practice. Go see. I'll give you the list of my competitors. Go see someone who's going to do what is in your best interest, and that's treat your hearing healthcare, treat you with dignity and respect. It does not have to be me, but not where you buy your mayonnaise, guys. Not this is it's incredible. It's unlawful. It's unethical. If I had this person's license, you believe that I would be reporting it. I feel so bad for this man because this is what he thought was good. Like, what a shame to our to the reputation of hearing aid specialists and audiologists. Like, what a shame to just audiology and as a whole, that we have this warehouse club that has so much market share that they are now one of the giants fitting all these hearing aids, and all they do is recruit and trying to get people to come in. Some of the stores will literally stop you when you're doing your groceries saying, have you had a hearing check today? Have you had a hearing evaluation? These are sales tactics, guys. Run, don't walk, run away. Go to a provider who's looking out for your best interest. I'm going to sign out before I have an aneurysm. I feel so bad for this person. And I'm going to make sure that he gets the care that he deserves. But I'm signing out, guys. Bald Hearing Guy. If you have questions, if you need a provider, ask me. I would be, even if it's not me, if you're like, it'd be kind of awkward if you're in my city and but if you're not, if you're looking for a recommendation, I'd be happy to recommend you to a provider that follows best practices, a person that leads in their community with integrity and does the right thing. All we do are Google reviews. Everything about my reputation is doing the right thing for my patients. I will gladly tell someone like this, go, we're not going to buy hearing aids. You take care of your healthcare first. That's what people should do. It's crazy how powerful a dollar bill is, that it can sway incentives and providers to be money motivated and not patient care, health care motivated. I'm done.